Pregnancy can be a very beautiful thing for every woman or most women. But sometimes when you don't know what to expect during the journey of pregnancy, it can be quite frustrating. Hello, this is Mimi. Today I'm here to share with you some of the things that I think you should expect during pregnancy. When you are pregnant, your body goes through a bunch of changes, and not knowing which stage you are, what changes your body is going through, can sometimes be frustrating and a little overwhelming. With these things that I'm going to list out, I think it can help you navigate through your journey of pregnancy. So stay tuned. First thing I want to talk about is the headache and the body weakness. When you are pregnant, you experience what seems like a chronic headache. The little thing you do, your head begins to ache. And then you feel like your body is so weak that you can't even lift up your hand. You become so weak. Sometimes, if you don't take care, you'll be in bed and you'll not even feel like getting out of the bed. You will sleep throughout the whole day. So when you start experiencing this, it's not like it's something to be alarmed. It's just part of the pregnancy. The next thing I'm talking about is loss of appetite. Yeah. Especially during the first trimester, you are going to experience loss of appetite. You'll not feel like eating anything at all. You feel like every food is just, it's a curse to you. You'll not even crave for anything. The moment that one steps in, prep yourself is part of the journey. And then nausea. Nausea is the next one. And sometimes it comes as a result of what we eat or what we drink. And sometimes it can be very unbearable that until you throw up or until you vomit, you will not feel okay. When you start vomiting and everything, and those throwing up is part of the pregnancy journey, take it in good faith and then be rest assured that as the months go by, it will reduce or it will even stop completely for you. And then you will become so sensitive to smell. Yeah, your nostrils will open. That the least thing. So sometimes you wouldn't even be able to be in a house where there's other fragrance or somebody's body lotion or the spray or perfumes or other chemicals. So make sure you stay away from that because sometimes when you get closer to smells, that makes you uncomfortable. It can enhance your weakness. It can make you feel more weaker. So make sure you stay away from all those potent chemicals and smells that can make you uncomfortable. And then saliva. Yeah, since we are all different, even with the things that I'm listing, the things that I'm sharing right now, some women may not even experience some of them. But because we are different human beings, others may also experience it. And saliva is one of the things. Not all women, all pregnant women experience that excess saliva in your mouth. But some of us, we do, especially myself here. And sometimes, if you are lucky, like within the first trimester, it will stop. Others, like myself, throughout all my previous pregnancies, the saliva will take you from day one to the day you deliver. So, if you are going through or experiencing that excess saliva, there are ways to mitigate it. And if you want to learn more about how to manage the saliva or how to reduce it, Now, it doesn't have a cure. You can't treat it completely, but you can manage it or you can reduce it so that when you are in public or when you're outside your house, you can be a bit comfortable. So if you want to know more about it, let me know in the comment section and I will give you a detailed video on how to manage the saliva during pregnancy. The next thing I'm talking about is dehydration. Because you are throwing up and then the saliva is coming out frequently, the probability of you being dehydrated is one. It's very high. And during pregnancy, especially within the first trimester, drinking water can be problematic, can be quite difficult. So if you don't pay keen attention to it, you end up feeling dehydrated and it can affect you and then the unborn baby. So there are ways that you can use to manage the dehydration that can encourage you to drink more water. Now, the one way that I'll show you, and if you want to know more, let me know in the comment section, is that add a little amount of lemon juice. Please, lemon is acidic, and if you take it in a concentrated way, it will be difficult for you to drink. So, just a few drops of lemon juice to change the taste of the water. So get yourself some chilled water and then add few drops of lemon juice to it. It will change the taste of the water for you so that it will be okay for you to drink. So make sure you add few drops of lemon to your chilled water. And the other thing that I'm talking about is after we've migrated from this first trimester into the second trimester, that is where you start experiencing the extreme hunger. And I said extreme because this type of hunger, it comes unannounced. The hunger comes unannounced. And the moment it's setting, it feels like if you don't get anything to eat right now, you will die. That is how it feels like. It feels like you're going to die if you don't get something to eat. Your whole body will shake, your whole body will vibrate because you are hungry. And sometimes, if you don't take care, you become angry and agitated because the the intensity of this hunger is something that you've not experienced before. So make sure wherever you are, there's some snack, a standby snack somewhere for you so that anytime it sets in, even a bite will make you feel at ease. Even a bite will make you feel at ease. And then your cravings will increase. At this stage, you will start craving for things. Sometimes you crave for silly things, things that might not be nutritious, but you crave for it. And when the cravings become too much, try and find that thing and eat it just to ease yourself or to feel at ease. Try and then eat some of the things that you are craving for if you can afford it. Try and then, and some of the things that we normally crave for, which I will advise you try and then control, is pepper, salt, and sometimes sugar. If you're somebody who experiences the excess saliva, try to reduce your sugar intake. So if you crave for sugar around that time, try and control it. And then the salt, adding extra salt to your food. Sometimes it can result in swollen feet, which is not healthy for any pregnant woman. So make sure you reduce it. And then the craving for pepper, spicy food. If you don't take care, you will experience heartburns. Heartburns is also part of the things that you go through. And sometimes, even if you've not eaten the spicy and the oily food, still you will experience the heartburns. But eating spicy food, food with hot pepper, and then food that contains grease or oil makes the heartburns increase. So try to control the cravings for such foods. If anything, when you are pregnant, you are going to experience frequent peeing. You'll be going to the washroom or the washroom frequently because the more your womb grows, the more it relaxes on your bladder, and then your bladder wouldn't be free enough to accommodate all the urine. So the little urine that comes in, it will prompt you to go to the washroom and then let it out. So you'll be going on frequent basis, and it is really good that you go on frequent basis because it will help reduce vaginal infections. You're also going to experience black pooping. Yes, when you poop, when you poop, it's going to be blackish. Not that black, but it's going to be blackish. Sometimes it feels like, have I chewed charcoal or something? Did I drink any black substance? No, it's just part of pregnancy. So you experience, so when you visit the washroom and you notice that there's this black poop in your pot, don't be alarmed. It's normal. Okay. And then the next thing I want to talk about is you're going to experience mouth cramps. You know that cramps that sometimes comes during our menses. I'm not talking about the extreme ones. When you experience extreme cramps, talk to your doctor about it. But these cramps that I'm talking about, it wouldn't last for 3 seconds or 10 seconds. Let me use 10 seconds. It wouldn't last for 10 seconds. It's just there, and then it's so mild. You feel like some tickling cramps there, that kind of things. So when you see it, it's normal. It's not like you're going to experience miscarriage. Yeah, it's just normal with it. And then the other thing that I'm talking about is bleeding gum. I don't know the science behind it, but the moment pregnancy sets in, your gum can bleed at any time, especially when you are brushing your teeth. And then you also experience sores in your mouth sometimes. It's not something that is frequent, but along the way, probably you experience it once or twice, or God knows how many. So watch out for that one too. And I'm also going to talk about vaginal infections. So it is part of pregnancy, but then with certain practices, you can reduce it. Like peeing before and after sex can reduce your vaginal infection. And then you can talk to your care provider so that if there are drugs or something that is safe for you, it can be administered to you. Because if you don't treat it, it will affect you one way or the other. And then if you are able to drink more water, you see, the more water you drink, the more you can pee. So if you pee frequently, drink more water, you pee frequently, it will be hard for the yeast and then the virus or whatever bacteria to stay down there. So try and then watch out for those vaginal infections. And it can be either you experience discharges, itchiness, dryness, etc. So if you get any infections down there and then you can't wrap your head around it, just talk to your service provider about it. It's part of the deal. The next thing I'm talking about is skin rashes. Skin rashes is an icon when it comes to pregnancy. One way or the other, you are going to experience certain rashes. Sometimes it's just acne. Though some of us might have acne in our faces. When you get pregnant, it might increase at a point in time during your journey. It might increase, or the other skin rashes. Sometimes you treat and they will not go away. But the funniest aspect is when you give birth, it will disappear on its own. I don't know whether it's part of the hormonal changes, but then expect it. So when you see any skin rashes, it's not a permanent thing. Don't be alarmed. It will go away. It will vanish. The next thing I'm talking about is dreams. In your journey through the pregnancy, you're going to have dreams. These dreams are going to be so vivid that you can recall every inch and bit of the dreams. Whether it's a good dream or a nightmare, you are going to experience both. Sometimes you experience good dreams, other times you are going to experience serious nightmares that will put some level of fear in you. Don't worry. God has got your back. Don't worry. God has your back. Everything will be okay. It's not like a demon or something is going to catch you in your dreams or somebody's after you. It's just part of the hormonal changes. The last thing I want to talk about right now is anxiety and stress. Yeah. It is just like the icing on the cake for pregnancy. You can't tell me that you've gone through pregnancy without anxiety, without stress. It's part of it. And if you want to know how to deal with all the stress during pregnancy and the anxiety during pregnancy, let me know. I will take you through all the things that I think can help you reduce it, all the things that I did during my previous pregnancies so that it can help you. Pregnancy and anxiety is part the thoughts that whether you are doing the right thing or the wrong, especially with the new moms. If you're a new mom, if this is your first pregnancy, sometimes you worry about, am I eating the right food? Am I doing the right thing? The least provocation, you start questioning yourself. Am I going to do something that will be detrimental to this baby? Is this baby going to come out all right? Is it going to have any deformity? Is it going to have any problem? Those are the things that comes in. And then carrying the whole load of your hormones and then your belly and everything can be really stressful, especially when you are a working mother and then you also have other kids in the house and then you are pregnant at the same time. It can be very, very stressful, but then it's part of it. So there are ways that you can use to navigate through it. And I'll share with you if you make a request for it. I'll share it with you. And please, the last tip I'm leaving with you, somewhere in the second trimester, you are going to feel okay. Yeah. All those weaknesses that you are experiencing in the first trimester, somewhere along the second trimester, is going to reduce. But please, the fact that it is reducing or it has reduced doesn't mean you are strong enough to do things that you used to do before you got pregnant. Don't challenge yourself too much. Don't push yourself too much. Do what you can do and do it best, but then with caution, with caution. And then remember, God always have your back. You matter, and the baby on the way matters a lot. So thank you for watching. Subscribe and then share this video. And then keep the comments coming in. I love you, but God loves you more. Bye.